Today we're going to cover Chapter 5. Chapter 5 deals with medical terminology and anatomy and physiology. One of my disappointments in this textbook, as a resource for you all to have, is the lack of information on anatomy and physiology. Anatomy and physiology is stressed under the new National EMS educational standards at every level, including EMT. And if you stop and think about why that's true, it makes a lot of sense. If you don't know how the human body is supposed to work under normal conditions, then you're probably not going to recognize it when it's working abnormally. And if you can't recognize the common ways in which the human body functions abnormally, there's no way that you're going to take action to correct it. And that's what your job is as an EMT, right? Your job is to recognize when people's body is functioning in an abnormal manner and then take steps to help it function more normally. That's the overriding goal of your job. So anatomy and physiology is pretty important to that, right? Yeah, you bet it is. The other part of this chapter that's really pretty lackluster, in my opinion, is the medical terminology. Now, we could spend 3 months and I could just teach you a medical terminology class. Why do you need to know medical terminology? When we're in the field, Mr. Shorter, and we're running a call together and I'm on the rescue unit and you're on the engine, do I use terms like, I think this patient is having a anaphylactoid reaction? Do you ever hear me say things like that? Not really, right? Do I ever say things like, my goodness, he has a gunshot wound 2 inches medial to his umbilicus? Do I say things like that on the scene? So why do you need to know medical terminology? You need to know medical terminology or you're not going to pass the test. That's why you need to know medical terminology, because one of the things I learned on committee with National Registry is that this test is basically written at a 7th grade vocabulary level. 7th grade. Except any medical term is fair game. Any medical term. Okay? So how important is medical terminology? Very important, because if you can't understand what the question's asking, you've got a pretty poor chance of getting the answer right, right? You got to understand what the question's asking and what the answers are. So that means you have to know the meaning of the words. I was amazed at the complexity of some of the medical terminology that we put on the test when I went to the committee meeting. It really blew me away. Things that I would never expect an EMT to know. They're expecting you to know to pass the test. Okay? They threw out words, by the way, because they said they were too advanced vocabulary, regular English vernacular words, that I couldn't believe they were throwing out. So all the language in the test is pretty simple, except for the medical terminology. So here you go, Mr. Zapata. Here's your time to help me out. Make sure everybody gets one of those. Make sure everybody gets one of those. Make sure everybody gets one of those. Make sure everybody gets one of those, and make sure everybody gets one of those. So what I'm giving you is a list of common root words, a list of common medical terms and abbreviations, a list of common medical terms used to describe direction and anatomical position, a list of common medical prefixes, and a list of common medical suffixes. I picked the top 600 or 700 that I thought was most important out of about 10,000. So now can you understand why I say we could spend a couple of months just talking about medical terminology? For my paramedic students, in one of the courses that I've taught in the past, I give this list out on the first day, and on the second class meeting, I give them this same list all printed on one sheet, except for with either the right-hand side or the left-hand side missing, and they have to fill it in. And it counts for about 25% of their grade. I'm not going to do that to you, but I probably should. learn all of these terms. Every single one of them. Memorize it. It is all fair game for testing from this point forward. So what are we going to try to achieve in this chapter? We're going to define some key terms. We're going to describe the importance of proper use of medical terminology. We're going to apply definitions of common prefixes, suffixes, and root words in determining the meaning of medical terms. Recognize the meaning of acronyms and abbreviations commonly used in emergency medical services, and give examples of when it is better to use a common or lay term to describe something than it is to use a medical term. We're going to use anatomical terms of position and direction to describe the location of body structures and positions of the body. We're going to utilize topographical anatomical landmarks as points of reference. We're going to describe the structures and functions in each of the following body systems: musculoskeletal, respiratory, cardiovascular, nervous, digestive, integumentary, endocrine, renal, and male and female reproductive. So what they're telling you is that in the next 45 minutes or so, I'm going to give you essentially all the information that I usually teach in 2 separate semester-long classes at Jeff State Community College. We have an entire course devoted to anatomy and physiology, and we have an entire course that's devoted to medical terminology. So I'm just going to hit the highlights. We're also going to describe the differences in the respiratory anatomy of children as compared to adults, and applying understanding of anatomy and physiology to explain the function of the life support chain. These are some of the topics we're going over in this presentation. Let's start off with the medical terminology. Medical terms have a structure to them, which is really good because you can memorize those prefixes and suffixes that I gave you and the root words, and if you remember all 3 of those things, those 3 lists, if you learn them pretty well, then it really doesn't matter what word you come across that's constructed with one of those prefixes, one of those root words, and or one of those suffixes. You can make a pretty educated guess as to what the term means. So the real key to this is memorizing the root words, the prefixes, and the suffixes. If you memorize the most common ones, you're really ahead of the game on medical terminology. So how does it work? They give the example of the root word nia or arth. Oftentimes there's a combining form with the root word, which will usually either be an O or an I. So, for example, if you combine the root word therm with the suffix meter, you get thermometer, which is a device which measures temperature. Thermo means temperature, meter means measure. That's why a thermometer is called a thermometer. It measures heat. There's a prefix. They give the example dis for dyspnea and tachy for tachypnea or tachypnic. What does that mean? Well, dis means dysfunction. Pnea means breathing. So what is dyspnea? It's dysfunction in breathing or difficulty breathing. Tachy means fast. Once again, nea means breathing. So tachypnea means what? Rapid breathing or fast breathing. There's a suffix itis. Itis generally means inflammation. Inflammation. Itis generally means inflammation as a suffix. What does arth, A-R-T-H-R, mean? Joint. So what's arthritis? Inflammation of a joint. See how it works? I'm using examples here that I think you're probably already familiar with, right? Sometimes you just jam 2 words together to make a medical term, like the virus smallpox, as opposed to cowpox or chickenpox. It's smallpox because the pustulates that you get from the disease smallpox are really small. Okay? So oftentimes we'll have medical terms where we just have 2 words that are kind of put together with no combining form. Tachy and cardia. Tachy means fast, cardia means heart, tachycardia means fast heart rate. Hemo means blood, thorax means chest, hemothorax means the condition where you have blood in your chest. So on and so forth. Y'all get the picture, right? Now I could make slides that has 10,000 medical terms on it, and I could put the word up and then read you the definition. Is that going to help you learn the words? No, it's not. It's just going to make your butt sore, and it's going to make me ill, right? Right? So, it's on you. Learn the words. Concentrate on the prefixes, root words, and suffixes. We also use acronyms and abbreviations. An acronym is an abbreviation that's made up of the initials of the words that the abbreviation is for, such as PCR is an acronym for Patient Care Report, right? Or EMS is an acronym for Emergency Medical Services. An abbreviation are letters or symbols used in place of words or phrases. That's really a bad example. They have DNR for an abbreviation. That's really an acronym, right? What would be a good abbreviation? Well, ASA is an abbreviation for aspirin. Well, those are really acronyms, not abbreviations. Say again? APP, he says, is for approximately. Yeah, except I would avoid that one because it's really close to APAP, APAP, which stands for what? Acetaminophen. Yeah, ABBR is a good abbreviation for abbreviation, right? Clever.